Hello, my name is Alexah. I'm with Genalyte. We are a diagnostics company rethinking how blood testing is done. So most of us have dealt with this issue. You go to the doctor, you get blood tests ordered, and then your job begins. You need to take off work, find a lab, wait for results. They're shipped across the country usually, and then try to decipher your results. And there's a lot of other problems that come up as well. We found that 25 to 40% of patients actually don't get their labs done when requested. 5% of results are incorrect. And clinicians spend 2 hours a day on average returning results, and this is unbillable time. Additionally, we have 7% of clinically significant results that never make it to the patient. So this is our Merlin, this is our solution. It's not just a device, it's a lab and it runs itself. So you can imagine this would be on site, a clinician's office. A hospital can pretty much go anywhere. And just like a lab, it wakes itself up in the morning, it runs all of its own controls, it's fully ready to go when you walk in the office. You have answers in 30 minutes, and you have answers for immunoassay, chemistry, and hematology tests. It's easy to use. We've made it very user-friendly. There's no plumbing, no special electrical needed, just a standard outlet, and you can use Wi-Fi, Ethernet cord, hotspot, anything like that for internet. We have a lot of fail-safes built in, so tracking how long from when the sample was taken to when the blood is actually tested, if the right tube was used, a lot of fail-safes can be built into the Merlin. It connects directly to the doctor's EMR, so no new software for them to learn, and it's just very ease of use. It can even bill insurance and draft reports for the patient and doctor. So it's just as simple as it sounds. It's draw, drop, done. You collect the sample, just a typical blood draw. You put it into the Merlin. You can put several tubes at a time, and it can hold up to 20. It'll keep them refrigerated and queue them as you need if you want to prioritize certain ones. And you get results 30 minutes automatically in your EMR. And this takes out the human error of pipetting blood, inverting it, all the 72% of errors that happen before the test is actually run. So how does this all work? The doctor puts the lab order in their EMR. The lab order goes to our cloud lab, and that is what really makes everything happen. From there, the lab order goes to the phlebotomist who draws the blood and prints the label that we've sent them through Cloud Lab. The blood with the tube goes into the Merlin along with that lab order, so it can make sure that the right tube was used, the right amount of blood was drawn, and those results go back to our Cloud Lab where they're verified by a clinical lab scientist, released, and sent back to the doctor. We can also bill insurance with the information we have from the EMR. And you'll see that the clinical lab scientists turn to AI. That's what we're planning so that we can give insights into the results and even tell things like, oh, this specific medication the patient is taking might be causing one of the results. So finally, we're in studies right now for FDA clearance on 36 tests. Our proprietary platform is the immunoassay analyzer that's within the Merlin. That has 2 FDA clearances and 1 FDA EUA. Right now, our round is to get us through these next FDA clearances and into commercialization. And in the future, we see a time when this is no longer the situation, and our kids and grandkids will ask us if we actually used to ship blood across the country. Thank you.